Hi all, after a long time, we are back to study. I know you people are all enjoying there in lockdown, but what to do, we have to start our studies of second year. So today, we are going to deal with a new subject, that is mental health nursing. Okay, now you people will be like in a confusion, what is mental health nursing? See, you people know what is definition of health, you know what is the definition of nursing. So henceforth you are going to deal with mental health nursing. Okay, telling a person who is not balanced with mentally. Okay, so going on to the introduction, by the end of this session you will be able to define what is mental health nursing, who all are the members included in mental health team, what are the characteristics of a mental health healthy person, what is the definition of mental illness, and defense mechanism. Okay, so let's begin. Mental health. What is mental health? It is a state. Okay, it's a state of balance between an individual and the surrounding. I repeat, it's a state of balance between the individual and the surroundings. Okay, or we can say it in another way, a state of harmony between oneself and others. A state of harmony between oneself and others. Okay, means there should be a matching or a balance. Okay, that is the introduction of mental health nursing. Fine. Moving on to the definition. Okay, what is mental health nursing? Okay, mental health nursing is an adjustment of a human behavior. I repeat, it is an adjustment of human behavior to the world, to each other, okay, with the maximum effectiveness of happiness. Okay, this is the definition given by Carl Menninger. I'll write it here, K-A-R-L, Carl Menninger, okay, in the year 1947. Okay, so I repeat the definition. Definition is an adjustment. Mental health is an adjustment of human beings towards the world, okay, and towards each other with the maximum effectiveness of happiness. This definition is given by Carl Menninger in 1947. Fine. See, in first year you might have dealt with the topic hospital. In that you have dealt or discussed about the teams of the hospital, who all are the members in the hospital, right? So now we are going to discuss about mental health team. Who all are included in a mental health team? In a mental health team, there will be a multidisciplinary approach. There will be a multidisciplinary approach which deals with seven set of members. Okay, the first member or the leader of the member is known as psychiatrist. Okay, psychiatrist. You people will be telling, no, go take her to psychiatrist, go take him to psychiatrist. What is a psychiatrist? A psychiatrist is a medical doctor who should be specialized in a training in psychiatry. Who should be specialized, who has taken a specialized training in psychiatry, okay, and who is accountable for medical diagnosis of the patient. Accountable means responsible. Okay, I repeat, psychiatrist is the team leader of mental health team. Okay, he is the team leader who will be a medical doctor with a specialized training in psychiatry, okay, and who is responsible for medical diagnosis of the patient. Okay, now what is the function or what is the role of a psychiatrist? Psychiatrist will be diagnosing a patient, okay, admitting the patient in acute or chronic stages, okay, prescribing medication. Say in psychiatry or mental health nursing, you will be prescribing psychopharmacology. In medical surgical, which you have already started, there you are dealing with pharmacological, with drugs which we are using for medical thing. This psychopharmacological means the drugs which are used in psychiatry. Okay, so a psychiatrist will be prescribing psychopharmacological drugs, okay, administering ECT. ECT. ECT is electroconvulsive therapy. I repeat, electroconvulsive therapy. Okay. Now, ECT is nothing it's a giving a shock, electric shock to the patient, which we will be discussing detailedly in the coming on classes. Okay. So the psychiatric first one was admitting the patient in acute care setting. Second one, prescribing medication, that is psychopharmacological medication. Then administering ECT. Okay. Conducting family or individual counselings. Okay. Then, or counselings or therapy we can say. Okay. Therapy means treatment. That's it. Then participating in the team. You know, the team leader is psychiatrist, right? Then a psychiatrist has the power to prescribe medication. Okay, sorry. Psychiatrist has the power to prescribe medication. So I hope you understood about psychiatrist. Okay. The second team member is the psychiatrist nurse. Okay, psychiatric nurse. A psychiatric nurse should be a registered nurse. A psychiatric nurse should be a registered nurse who should have a specific or special training in care and treatment of psychiatric patients. She should have an education qualification of diploma or degree, MSc, MPhil, PhD in psychiatric nursing. Okay, want me to repeat once again? I'll repeat it. Psychiatric nurse is a registered nurse who should have a specific or a specialized training in care and treatment of a psychiatric patient. Okay. The nurse educational qualification, she should have either diploma, degree, MSc, MPhil, PhD in psychiatric nursing. Okay. So what is the function of a nurse? You all know in Nursing Foundation we have discussed a lot about function of nurse, what is a nurse, quality of nurse, right? Here we are going to discuss what is the function of a psychiatric nurse. Okay. Here the psychiatric nurse, same in nursing as Nursing Foundation we have seen. Here also the psychiatric nurse will be administering, monitoring the patient, giving the medication. Okay. Then assisting in several psychiatric therapies. Okay, participating in the team. Okay, then taking responsibility of the record, teaching the patient as well as the family, and here the nurse act as a advocate also. Fine. This was the role of a psychiatric nurse. Then moving on to the clinical psychologist. Psychologist means a person who should have a qualification of master degree in psychology. Okay. Here in psychiatric mental health team, what is a psychologist doing means he is assessing or giving therapies to the patient, like individual therapy, behavioral therapy, cognitive therapy. These all things, don't worry, you will be discussing later on in the unit. Okay. So individual therapy, in that also play therapy will be there, dance therapy, music therapy, everything according to the patient is given by a psychologist. Okay. Fine. Next, we are going to deal with a counselor. I think so. In every one of us, some of the other time in our life, sometimes we are not able to take a particular decision. We might take a help of a person to guide us. Okay. So here, a counselor means a supporting the patient. Okay. Psychologically by giving them education. Okay. And making their mind active. That is a role of a counselor. Fine. Counselor. Then we are going to deal about the psychiatric social worker. Social worker means the person who is working with the society. Okay. Social worker should have a master degree in social. So like MSW we say. Masters in social worker. Okay. What they are doing is like they will be who is accountable, who is responsible for family care. Okay. By he or she emphasizing interest with the patient in the social environment. MSW or a social worker, what they have to do is like a patient's family is not giving particular support. Social workers will be giving or educating the family and the family member or patient, okay, everyone in the society. Like what is causing the in childhood behavior, childhood disorders, the mother is not, the child is not getting proper care from the mother. For giving education and all, social workers are playing a very good role in psychiatric team. Okay. Then we are going to deal with occupational therapist. Occupational therapist. Occupational therapist means the person who gives therapy to the patient. Occupational therapist. Occupational therapist means he is responsible for the recreational program. Like you all have programs in our college, right? Some person will be the head of the program to take care of all the things, to arrange all the things, right? The same way, occupational therapist means assist the patient to gain their skills. See, a psychiatric patient will be a mentally ill patient, okay? For them to recreate the skills which they have lost, that we have to recreate it, okay? For that, a specifically employed person only will be taken care. That is dealing with the occupational therapist, okay? I hope you understood about the mental health team. Mental health team is a psychiatrist, a psychiatric nurse, counselor, psychologist, okay, occupational social worker, occupational therapist, counselor, okay, 7 members are there. I hope you are clear with the mental health team. Fine. Can I move on? Okay. So now next we are going to deal with what are the characteristics of mentally healthy person. So when we are dealing with this subject, you people will be having a problem. Am I normal or am I abnormal? So a normal person, what and all characteristics he or she is bearing it is like ability to make an adjustment. The people are from your native. When you come and stay in the hostel, you are making an adjustment. That means you are normal. Okay. Then sense of personal worth. I am worthful. I am something, I'm special, I'm worthful. A feeling of worthful is normal. Okay. Then if you have any problem, any stress or something, you should have the capacity or ability to cope this problem. That means you are normal. Okay. Sense of responsibility. Responsibility means if somebody is giving you some work, you are responsible for the work and you have to submit it or you have to do it in the proper time. That is responsible. Okay. Give and accept, respect, love. Okay. Then accept the world in the reality. Or you people are in a what to say, fantasy world where Tom and Jerry is still there in our life, right? We all are in a reality, right? Then showing emotionally mature behavior. Okay. Then sense of personal security. When you walk alone, you know that nobody can do anything to me. I am secured by myself. Personal security, okay, and a feeling secure in a group. When you are going in your family, you are very much secured in a family. Okay, I'm sorry. Then a capacity to tolerate the frustration. Like you don't like a person, but still you are not able to show in front of him. You are mature to tolerate him. That means you are mentally healthy. Then the purpose of daily activities. Brushing. Why do you want to brush? Why do you want to take bath? If you know everything, that means you are mentally healthy. Then personal with varieties of interest. Some people have interest in cooking. Some people have interest in reading. Some people have interest in sleeping. Right? So whatever is their interest, you are taking it in your daily life. That means you are mentally healthy. So I think so you people have understood what is the characteristics of mentally healthy person. I repeat it. The ability to make adjustment, feeling worthful, solving problem, sense of responsibility, giving and accepting love and respect, accepting the world in a reality, showing emotional maturity, okay, then sense of personal security and feeling secure in a group, then ability to capacity to tolerate the frustration, okay, then giving the purpose or making a purpose of daily life, daily activities, and bringing out the interest in the daily life. These all are the mentally healthy person's characteristics. Okay. Next, we are going to deal with what is a mental illness. Mental illness. We already discussed we know what is health, right? We know what is illness. So, mentally illness. Physically, they don't have any problem, but mentally they have problem. That means there is a disharmony. You remember in the starting of this session, I told that there was a harmony between oneself and others, right? So what is a mental illness means? It is a maladjustment. The person is not able to adjust, okay, in a living Okay, person is not able to adjust. A disharmony of person's ability to meet person needs comfortably and effectively. Person is not able to deal comfortably in his daily life with an effectiveness of happiness, that is known as mental illness. I repeat the definition. It's a maladjustment or a disharmony in person's ability to meet human needs comfortably or effectively. Fine. Then the last we are going to deal with defense mechanism. Okay. What is defense mechanism? Defense mechanism in shortly or in a simple local language we can say it as coping mechanism. See, if I shout at you, you feel little sad, or you feel little crying, or you feel angry, right? That all emotions are called as defense mechanism. Few examples and few defense mechanism we will be discussing today. Okay, let's start. The first defense mechanism is repression. 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 What is repression? Repression means unconsciously, I repeat, unconsciously forgetting a painful idea, event, or a conflict. Conflict means a fight. Okay? Unconsciously forgetting a painful event, ideas, or conflicts. Okay? For example, there are two lovers. Okay? They had a breakup. So, forgetting a loved one's or a lover's, whatever, okay, a loved one's birthday purposefully after a fight. Example is clear. Forgetting a loved one's birthday after a fight. So, repression, I repeat once again, repression is unconsciously forgetting a painful event or conflict. Fine. Example, forgetting a loved one's birthday after a fight. Is it clear? Next, we are moving on to denial. Denial. Okay. Denial. Denial means a mother or somebody in your family. Somebody, or I personally, I am coming and telling you, you will fail in exam. Will you accept it? Will you accept it? No, right? You will deny it. No, madam, I will pass. That is called denial. Denial means unconsciously refusal of or to admit things. Unconsciously refusal to admit things. For example, a mother and a child has been admitted in a hospital and the child is very much serious and doctor is coming and telling to the mother, see, your child is very much serious. Okay, what will the mother say? Okay, fine, doctor. Oh, it's okay, no problem. Will she say like that? No, she will say that, no, your treatment is not good. My child was okay as he has come here. Okay, if you are not able to take care of my child, I'll shift the child to a new hospital. They will not accept the reality. Okay, denial means unconsciously refusal to admit the fact. Understood? Denial. Okay. Third one is displacement. Displacement. Displacement means putting a emotion or showing an emotion which we are not able to show to others, we are showing it to the someone else. Say if your mother is scolding you, you are not able to scold your mother back, right? You will go and scold your brother, younger brother, because he will not scold you back, right? That is called as displacement. Showing a emotion, a displacement definition goes like that: unconsciously discharging feeling to a less threatening object. Showing emotion to a less threatening object unconsciously. Okay. For example, we can say a husband comes home after a busy day or a fight with a boss, and after coming home showing a emotion to the showing or blasting the wife. Okay. Or yells at his wife. Fine. Can I move on to the next displacement? Displacement is clear? Next one is rationalization. Rationalization. Rationalization means a person, for example, I can say a student failed in an exam. Okay? But when you ask why did you fail in the exam, they'll not accept because of my mistake, I didn't study, that's why I failed. No. They'll tell this hostel atmosphere is not good. This is not good for my studies. That's why I failed in exam. That is called rationalization. Definition goes like this: the individual justifies his failure, okay, by putting the blame on the society. Okay, understood? Or the environment, society or the environment. For example, a student who fails in the examination put the blame on the hostile atmosphere, saying that because of this atmosphere I am failing in the exam. Fine? Is it okay? Next one is undoing. Undoing. Undoing means if a person, if a child is telling a bad word, if you are supporting the child, okay, it's good, okay, no problem. That is called undoing. Undoing means giving or consciously doing something wrong thing, okay, and you are supporting that undoing. Person should not be doing that. But like small kids and all, when they go to school and come back, they'll bring some rubber and all. From childhood only, the mother should treat or give that this is wrong, you should not do like this, this is wrong, you should respect elders. They'll not say like that. Okay, undoing means the person is doing something wrong and the elders are supporting them. That is known as undoing. Okay, next one is regression. Don't get confused. First one is repression. Then sixth one is regression. Okay? Regression. Regression means temper tantrum. Temper tantrum means what? Temper tantrum means small kids and all, you might have taken them. They say, no, I want this, I want this. They have the temper tantrum. Ziddi. Right? In Hindi we say ziddi. So an adult if shows the temper tantrum, that means he or she is having some problem, right? So regression means an adult throws a temper tantrum when he is not getting his goal. He wants something and that thing is not getting, so he is showing a temper tantrum. Temper tantrum. TEMPER TANTRUM. Temper tantrum. So regression is clear. Don't get confused. Regression and repression. Repression is unconsciously forgetting something. Okay. Regression is throwing temper tantrum by an adult. Okay. Next one is conversion. 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 Conversion means today is a final exam. Okay. Students wake up in the morning and say, oh my god, I'm having severe headache or migraine, I can't write this exam. Means not able to face the stressful moment, running away from the stressful moment, or something which we are having a fear, running away from that defense mechanism is called as conversion. Usually you people also say in the class, no, if you have not studied something, you say, ma'am, I am having headache, I am having stomachache, isn't it? The same thing. That conversion thing is not, here we are dealing in defense mechanism. Okay. Unconsciously showing expression, okay, through so showing expression to get relieved from some conflict through physical symptoms. Symptoms is what? Migraine, headache. The person awakes in the morning telling that, oh my god, today I am having final exam, I have not studied anything, if I apply in that exam I will fail definitely, so I don't want to apply, saying that I am having headache, I can't apply the exam. Fine. That is known as conversion. Fine. Next we are going to deal with sublimation. 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 Sublimation means person aggressive. Aggressiveness means what? Anger. Okay, anger. The anger or what to say? Competitiveness. Okay, a person who is not good or not well in studies show in some colleges, not in our college, but some other colleges, there should be in theory as well as in sports. Both, if they are getting passed, then only they will have a good internal marks. Okay, in higher colleges like MBBS and law colleges and all, they are following these rules. So what happened? The person who is not good in theory or in class, what he will do? He will manage it in sports. He is very good in sports. Okay, so the aggressiveness might be transferred as a competitiveness, a competition in sports. That is known as sublimation. Okay, don't worry, I'll be giving you the notes. Just listen and understand. In psychiatry or mental health nursing, it's what you want to know is like understand what I am teaching. And if you have any of doubts in this, please get back to me, or don't discuss among yourself and make it a big doubt. Okay, nobody will solve that. If you have doubt, come back to me, ask me. I'm here to help you anytime. Okay, so we were discussing about sublimation. Okay, sublimation means consciously the person, no, I will not get good marks in theory, but I will get good marks in sports. Same way, the person who is not good in sports, they knows that I might not get good marks in sports, so I have to concentrate in studies. That is known as sublimation. Competition, aggressiveness is showing in the sports. Okay, then is projection, which you people always shows. Both two students are there. Okay, you can put any of the names, any of your classmates names. Both have done the same mistake, but what the other person will do? Ma'am, I did only this much, she has done this much. Projection means showing other person's or blaming other person's mistake, showing it in a big, making it big. Okay, I have also done a mistake, she have also done a mistake. What am I doing? I am showing her, I am projecting her mistake as big and my mistake as small. That is known as projection. Okay, projection means person blaming another person's mistake, but the person has also done the same mistake. Okay, but just boosting it or showing it bigger, that this person's mistake is bigger than my mistake. Understood? That is known as projection. Okay, last one is dissociation. Dissociation means forgetfulness, which usually you people, today if I am taking class, tomorrow if I am asking, what you say? Ma'am, I forgot, ma'am. Assignment date also, ma'am, I forgot, ma'am. You say no. That is known as dissociation. Now few people will be thinking, oh, mujhe bhi hai kya dissociation, right? Dissociation means amnesia. Amnesia means forgetfulness. Okay. Dissociation means recall previous days means after an accident. Okay, the person is not able to recollect or remember what had happened last day. That is known as dissociation. Okay, forgetfulness which occurred after an accident or after a trauma, the person is not able to recall his memory or recall his thinking, is known as dissociation. Fine. So I am just stopping it here. We will be discussing in the next section also. Okay, so I'll just conclude the topic. Today we discussed about mental health nursing, a new subject for you people. Mental health nursing, I said it is a state of harmony between oneself and others. Okay, definition of mental health nursing was given by Carl Menger in 1947. Okay, I hope you all are clear with the definition. Definition is like it's an adjustment of the human with the world. Okay, to each other with the maximum effectiveness of happiness. Okay, mental health team has 7 members: a psychiatrist, psychiatric nurse, okay, then a clinical psychologist, counselor, social worker, therapist, dietitian and counselor. Okay, dietitian is nothing, providing proper food, which you have already discussed in nursing foundation. Okay, then we discussed about the roles of each team members. Okay, then we are discussing about defense mechanism. 10 defense mechanism we have discussed today. Repression. Okay, repression means unconsciously forgetting something, a painful event. Example, I said forgetting a loved one's birthday after a fight. Denial means unexpected or not accepting the fact. Displacement means showing an emotion to a less threatened object. Rationalization means what? Rationalization means students fail in the exam and showing or blaming the hostile environment for that. Undoing means the mistake which a person is doing is supported by the elders. Regression means throwing temper tantrum. Conversion means morning they are awaking with a migraine headache, saying that I can't write the final exam because I am having a migraine. Okay. Sublimation is what? Aggressiveness or anger or competition which they are showing in the sports. Okay, that is sublimation. Projection means two person have done the same mistake but blaming the other person, saying that the other person has done something bigger than them. Okay, that is called as projection. Dissociation means the person after a trauma or after an accident, the person is having amnesia. Amnesia means forgetfulness what they have, recollecting their past emotional feelings. Okay, then fine, take care, bye.